Hi everybody, welcome to Snow Day Part 2, 2.5, whatever you want to call it. I'm going to do a short lecture here on the beginning of the respiratory system. Remember that your second exam is the Wednesday after we return from spring break. So on that Monday we will do a little bit more of this chapter, and the test will be over however far it is that we get. So let's first look at what the respiratory system is supposed to do. So the first one is pulmonary ventilation. We talked about this in lab. That is just a really fancy term for breathing. And we said that breathing has two components: inspiration, or the intake of air, and expiration, the movement of air out. What a lot of people don't realize is they think a lot about the lungs and the trachea and the nose when they think about the respiratory system. But in order to do pulmonary ventilation properly, we actually rely on a lot of muscles, like your diaphragm and your intercostal muscles. Now, the other function, we talked about these three in lab, and again, these are ones that are, the names are kind of weird, so you just have to work hard to remember these. The first one is external respiration. This is the exchange of gases that is going to occur between the lungs and the blood. So for oxygen, we've taken it into our lungs and it will diffuse into the blood. And in the case of CO2 that's been created as waste by our cells, that is going to diffuse out of our blood into the lungs so we can breathe it out. So the important thing to remember about external respiration is it's happening between the blood and the lungs. Now, internal respiration is what happens between the blood and the tissues. So this oxygen that is now in our blood attached to our hemoglobin will diffuse into the tissues that need it. And CO2 that is in our tissues, again, that has been formed as waste, will diffuse out of the tissues into the blood. And again, that will eventually make its way back to the lungs, and it will eventually get breathed out. Now, what goes in between those is obviously this transportation of these respiratory gases. So for oxygen, we know that that oxygen is going to move around bound to hemoglobin. For carbon dioxide, it's actually a little bit different. That's a very common misconception, is that when oxygen lets go of hemoglobin, carbon dioxide just takes over. And a little bit of it does that, but only a really tiny percent. Most of our carbon dioxide in our blood is actually going to get converted to something else until right before it gets back to the lungs. We'll talk about that later on in this chapter. So let's talk about the zones. We can really divvy the respiratory system up into a couple of different sections. So the first one is the respiratory zone. These are the really, really teensy tiny microscopic structures that are involved in your respiratory system. This is where gas exchange is actually going to be occurring. Now, the largest structure in the respiratory zone are these respiratory bronchioles. Now, that word bronchiole is going to come up a lot, but there's usually a word in front of it: respiratory, terminal, primary. So respiratory bronchioles are the smallest ones, and notice what they have on top of them, are kind of clustered at the end, are these clusters of alveoli called alveolar sacs. So each one of these small clusters of grape-looking structures is an alveolar sac, and each little individual grape, if you will, is an individual alveoli. This is where gas exchange is actually going to happen in your lungs. The conducting zone is pretty much everything else in the respiratory system. The goal of these structures is mostly to get the air from the outside to the respiratory zone. Now notice I keep using the term air here because it is really important to remember that when we breathe in, we're not breathing in pure oxygen, right? We're breathing in air, which has a lot of oxygen in it, but it also has some other gases in there. So I'm trying to differentiate between air and oxygen here. Now, most of these passageways are really rigid because the very last thing you want is any of these structures to collapse. So things like your nasal cavity and your throat and your primary and secondary bronchi, those are really rigid structures because if they collapsed or were blocked for some reason, you couldn't get air down to the respiratory zone. No gas exchange occurs here. This is merely a tube. It does a couple other things besides transport that air. It can clean the air out. We know, especially up in the nasal cavity, there's little hairs and there's mucus that can trap debris or bacteria or viruses that we're breathing in. And it also helps to warm up that air. Even though it may not be cold outside, our body wants to warm up the air coming in and actually moisturizes that air too, makes it nice and humid. So let's start at the top. We're going to start with our nose and we're going to work all the way down to our lungs. Now, on your lab handout from 2 weeks ago were all of these structures that you actually have to identify in lab. That is just a what is this, what is this, what is this on the practical. For this exam, you need to know what these different structures do. So your nose actually does a lot more than people realize. It is an airway. We know we can breathe in and bring air in through our nose. It does moisten that air. We do have mucus in our nose. Even when you're not all snotty, you've got mucus in your nose. It does filter it. We have little hairs in our nose. It's really important for speech. And if you've ever been sick and had a stuffy nose, you kind of sound funny and you kind of sound like this, because your nose is plugged up and the sound can't resonate out of your nose the same way. And this is where our smellers are. Those olfactory receptors that allow us to differentiate different chemical odor stimuli are located in our nose. Now, the outside portion of your nose, your external nose, is going to involve 3 of the bones of your skull, your nasal, so that makes up the bridge of your nose. The frontal bone and the maxillary bone kind of help make up the side structure of the top of your nose. The tip of your nose, though, if you just reach up and wiggle it, and I'm kind of laughing right now thinking about all of you wiggling your nose because I'm doing it too, is hyaline cartilage. And we also have some dense fibrous connective tissue making up that outside little hump of your nose. So when people get a nose job, a lot of what happens is often some shaving down of the cartilage or the dense fibrous connective tissue to maybe refine the shape of the nose a little bit. Now, the nasal cavity is what's inside the head. So this large open area, air will come in through the nostril. We have a little area there called the nasal vestibule, kind of right where you would stick your finger in your nose. And then we have this large open cavity called the nasal cavity. So the top of it is made by the ethmoid and sphenoid bones, and the bottom of it is made by the hard palate in the front part of the nasal cavity. So if you push your tongue up against the roof of your mouth, the roof of your mouth is actually the bottom of your nasal cavity as well. And then the back of your nasal cavity is the soft palate. There's not a bone involved here. Now, the nasal vestibule, like I mentioned, is air is going to move into there from the nostrils. And believe it or not, it actually has sweat glands, which is kind of weird, and sebaceous glands and hair follicles. And this is where a lot of that humidification of air, as well as some of the trapping of foreign particles or debris can happen. If we can stop them there, then we can keep some of that stuff from getting down into our nasal cavity. Now, the whole nasal cavity, so this whole area, the top hard bony plate from the ethmoid and sphenoid and the bottom part, is lined with what's called olfactory mucosa. Now, the part that is actually responsible for smelling, if you will, is actually very, very small. It's located kind of right here up in the roof area of your nose, right here. And that is the only place that smell receptors are going to be located. And this is kind of tricky because that is not the natural place that air hits when you breathe in through your nose. So that's why sniffing, short like bursts of air being brought into your nose, can actually help you smell something a little bit better. Think of what dogs do. They sniff all the time, and those short bursts of air can pass those chemical odorants across their olfactory epithelium. Now, most of the nasal cavity, kind of the rest of it, is lined with respiratory mucosa. So the olfactory mucosa was the little part up here with the smellers, and the respiratory mucosa lines everything else. So this is pseudostratified columnar epithelium, and it does have cilia. And it's really important. A lot of the times when we see areas with high mucus production, we do see cilia present because mucus is great. Mucus traps things. But we have to have a way to move that mucus along. And that's why the cilia become really, really important to have there. So we actually have some cells that are producing mucus here, and the cells also produce defensins, which we talked about relative to the innate immune system was a substance that had some antimicrobial properties. So even if we did breathe something in and it got trapped in that mucus, those defensins could kill the substance and it wouldn't just kind of sit there and fester in your nasal cavity. Now, this is crazy to me. We make about 1 liter of mucus a day, and that's when we're not sick. So imagine how much you make when you're sick. Mucus contains lysozyme, which was another one of those chemical defenders that we found in our body. We talked about it back in chapter 21. And the whole purpose of mucus is obviously it can trap stuff. It's very thick and viscous and sticky. So it could trap bacteria or viruses or pollen or dust or whatever. Because we have those defensins and the lysozyme present, it can destroy bacteria. And it helps to humidify the air. Mucus is very moist. So when we breathe air into our nasal cavity that has all this mucus around it, the air becomes a little bit more moist before it continues down our trachea. Now the really gross part is, if we're making 1 liter of mucus a day, where does it go? The answer is we swallow it, which is pretty disgusting. This is why too, in small children who have allergies, one of the common problems is, they have allergies, so they're making a lot of mucus, and they swallow it, and it makes them very upset to their stomach and can often trigger vomiting. That's because all that mucus is getting swallowed. Now, when we have a cold, what happens is we start to get a congestion of that mucus, right? We start to get some inflammation here in the nasal cavities. We start to produce even more mucus. And so we start to just get that mucus kind of clogging up that nasal cavity, right? You just feel like you can't breathe. Every time you blow your nose, you're blowing stuff out of it. What's really interesting is we do have some reflexes that help protect our body as well. Say you're dusting and you get a big snoot full of dust in your nose, it often triggers you to sneeze. That reflex is actually triggered when those little particles come into your nasal cavity to try and get them out before they can cause a problem. Now, this is actually a cross-section of a cadaver, so you can see here's the nasal cavity right here. I'm really hoping you guys can see my cursor making circles on here. Up at the top, this little fringy area, there's the olfactory epithelium. And you notice we actually have these little scroll-like projections called nasal conchae. There's 3 of them. There's a superior, there's an inferior, a middle and an inferior. And they have these little grooves in between them that are called the nasal meatus. And these are actually really important because as we bring air in through our nose, these nasal conchae actually increase the turbulence of that air. Instead of the air moving across a really smooth surface, it kind of bounces around amongst those scroll-like structures. This helps make sure it passes the smeller, the olfactory epithelium, and it's giving that air a little bit of time to warm up and humidify before it moves down into some of our lower nasal passages. Now, it is going to increase surface area as well. Because this raised area, we have more surface on which that respiratory mucosa can be, so we have more of those mucus-producing cells. It does enhance turbulence. It can trap big particles. This is the really hard part, is really, really little particles are really easy to breathe down into your lungs. So that's why, in a lot of jobs, they require that you wear some kind of mask. Like if you're working with insulation, for example, you're supposed to wear a mask because that fiberglass is really tiny and could get breathed down. This was the really hard part with asbestos. These really, really tiny particles that you could inhale down into your lungs very easily. So the big stuff can get trapped here. We're going to have some other mechanisms to deal with small particles that may get inhaled later. And this also, too, when we breathe out, we don't want to lose an immense amount of moisture with our breath. And we know we lose some. This is why you fog up a mirror, right? If you put a mirror under somebody's nose, their breath is going to fog it up. Because we are losing some moisture with our breath, but the goal here is to hang on to as much of it as we can when air is moving back out of our nose. Now this is just a slightly different view. You can see the nasal conchae here. You can see the olfactory epithelium right there and how that creates that turbulence. Now the sinuses, I think I've mentioned these before in class. Sinuses are just openings in the bone. And we have several different ones. The frontal sinus, kind of right there between your eyes. Ethmoid at the bridge of your nose. The maxillary is probably the one we talk about the most. If you get a sinus infection, kind of in that cheekbone area, that's the most common one that hurts. The sphenoid sinus is kind of right back in front of your ear. Now these are pretty important because they actually help lighten the skull. If the skull was just completely solid bone, it'd be really heavy, and it already is really heavy, right? Your head weighs like 8 pounds, including your brain. So let's try and lighten it up a little bit. But it actually plays a role as well. It provides an area for air to be warmed and moistened, and it's another place that mucus is produced. And if you've ever had a sinus infection or sinus congestion, you know that when those sinuses aren't draining correctly, it can make for a pretty miserable couple of days. So the last little thing I'm going to talk about here is the pharynx. And the pharynx is just your throat. And what it's going to do is it's going to connect the nasal cavity and the mouth down to the larynx, right, or your voice box. So believe it or not, your throat ranges all the way from the base of your skull down to your 6th cervical vertebrae. So it's give or take 5 inches, of course, depending on how big you are. And it can be divvied up into these 3 components. So the nasopharynx is back here at the back of the nasal cavity. The oropharynx is at the back of the mouth. And the laryngopharynx is kind of what I traditionally think of as the throat itself, kind of down in the neck part of your throat. Now, the nasopharynx is, notice the directions here, inferior to the sphenoid and superior to the soft palate. And what's really important about the soft palate is when we swallow food, we want food to go down, not up, because the nasopharynx's job is air only. But we know that's not always the case. Ideally, what will happen when you are swallowing food is this soft palate will actually come up and close off your nasopharynx from your oropharynx. But, right, and this is where your uvula becomes important too. That crazy little hangy-downy thing in the back of your mouth actually has a job. When you swallow, it swings upward to close off your nasopharynx. But the really tricky part is if you laugh when you have something in your mouth, a lot of times this doesn't work, which is how you can squirt milk out of your nose when you're laughing. We do have pseudostratified ciliated epithelium, so still those cells that are going to propel the mucus along. So the really important thing here is remember this is air only. Now your oropharynx is going to be obviously air and food, because any air that you bring in your nose is going to move from the nasopharynx down into the oropharynx, and any air you bring in your mouth will come into the oropharynx, and the food that you swallow comes into the oropharynx. Now this is a really different tissue type. Instead of this pseudostratified ciliated columnar epithelium, we now have stratified squamous epithelium. And the reason for this is food can be very abrasive, right? Think about, eating some Doritos or drinking some hot coffee. We really put our mouth through the ringer in terms of the food that we're coming in. And all that stuff that's in your mouth eventually winds up in your oropharynx. So this simple squamous epithelium is providing some protection against the foodstuffs that you're swallowing. Now the laryngopharynx, right, kind of the throat part, is actually going to have to involve the epiglottis, because the very top part of the laryngopharynx, it is going to transport food and air, but eventually we're going to reach a spot where food is going to go one direction, it's going to go to the esophagus, and air is going to go another direction to the trachea. Okay? We do eventually want food and air to split apart. We still see that stratified squamous epithelium because, again, if food is involved, it could be abrasive. Even though we chew up food, there's still little bits and sharp bobs that could do some damage to our tissue there. Now, you'll notice right here, here's the laryngopharynx, and you can see that that kind of branches off down here into the esophagus where the food is going to continue, and the trachea, or the larynx, which will eventually lead to the trachea, where the air is going to go. Now, a really important part of the larynx right here is the epiglottis. This is a little flap of connective tissue that is going to keep food out of the trachea. That is the ideal situation. When we swallow food, what the epiglottis should do is flap down and cover over the larynx, so food does not go down your quote-unquote windpipe. And we've all experienced this, right? You get choked and you start coughing and you cough up whatever it was. That sometimes is because your epiglottis did not close completely. This can happen a lot when you're eating too fast, or maybe you don't chew your food sufficiently. Now I'm going to stop here. We will pick up with the rest of the larynx in class on the Monday after spring break. There are top hat questions associated with the stuff that we just talked about, so make sure that you get those completed, and go ahead and go on Georgia View and post your test questions that may be included on exam 2. Stay warm.